Hello and welcome to the Uprising Show. I'm your host Vivek Nanda, and today we are here to discuss my favorite topics in the healthcare world: healthcare operations and customer service. And for this, I've gotten two very experienced folks here with me. I have Troy Schaffer and Frederik Mueller. And Troy, I would start from you. Let you have you introduce yourself first, please.
Great, thanks. Hi, I'm Troy Schaffer, Vice President of Contact Center Operations with Scan Health Plan, and it's just been a great journey to be in this space.
Welcome, Troy.
Thank you.
Frederick.
Yeah, hi. My name is Frederik Mueller. I am the co-founder and CEO of Third Way Health. We are a technology-enabled modern healthcare BPO company. And yeah, likewise, I'm really glad to be here and thank you for the invite.
Great. So we will straight away dive into the business. And I would start with you, Troy, for this question. So, in your roles, both of you, you have innovated the way your organizations interact with customers. So, could you share a pivotal change that you implemented that transformed the customer interaction and how it has impacted the business outcomes?
Sure. Yeah. A couple of things I would say. One is I really believe like people are our greatest asset, and however you train them and have them engage with your members is going to be a big part of your reputation, your brand, and how that interacts. And so, first thing I did, we were called member service representatives. When I got there, that was the team names, their titles, and couldn't vibe with that representative. I said we are truly advocating for our members,
Mm.
and so we went through and changed every single title to member service advocate. And so that's what we do as a not-for-profit. We advocate on behalf of our members, and it really resonated throughout not only like our team but the organization and our members as well. I had to present it to our board. Our board approved it, so it was a really big deal. But I think just foundationally getting that change there really helped resonate in how we interact with our members and what the roles our folks play.
I love that because I've spoken it on many times to many people that in healthcare we always think trying to find the magic wand. We always try to go to tech, but
Yes.
we forget about the people. It's actually other way. It's always like people first, and then we try to find what we can enable people. That's why I love this point that this is. I am 100% sure how this might have been taken by everybody in the organization. Such an important thing. Frederick, what about you?
Yeah, look, I think there's a few things also that come to mind, and of course one of the things that's top of mind that I think we could always talk about is how do you use technology. And I feel like you can't be in a conversation in a call center context without using generative AI. But and that is important, and there's stuff we're doing. But honestly, the biggest changes and that we've made are similar to what Troy you mentioned on the people side. And specifically, two things stand out that one is we when we started Third Way, and we're a younger organization, we specifically made the decision to invest in our talent, right? And so we said we're going to actually pay above market, and we're going to increase your benefits, and we're going to invest in your well-being at work. So much so that there's more services at our workplace than when I'm at home or anywhere else. And honestly, healthcare, I fundamentally believe, is buy-in in between people, and we want to make sure that our people like the work that they're doing, and they don't have anything else that they need to worry about. So that's step one. I think step two is it's this delicate balance, and I'm sure Troy, you've seen this many times as well, is how do you make sure that you have standardized responses, but at the same time you're innovating for the patient, right? Because it's always this delicate balance between the two. And so we started to specifically teach problem solving to our team because in because nothing is more frustrating as a member, as a patient, when you feel like you're asking a straightforward question and you're not, and you're getting the straightforward answer that's out of the playbook. And so I feel like those two things are what we generally see have made a really big impact.
Interesting. Thanks. Um, So, Troy, I mean, in all transparency, I actually saw one of your 2021 podcasts, and you talked about a couple of things that really resonated with me. And I was like, I need to get you on the spot to talk about those two things. And so I'm going to pick one of those things first. So, you have mentioned the importance of understanding customer triggers early on in the conversation. And in that conversation, you were saying that there's always KPIs and stuff teams have to meet, but the success come from understanding the customer triggers early on in these conversations with customers. So can you elaborate on how your team has successfully implement that thing, how it works?
Yeah, yeah. I mean, you hit on an important point, and I think Frederick mentioned this earlier, is that balance between having consistency in like your greetings, your closings, but then also what we focus on is critical thinking skills. So, a member may call about one item, and then as you talk to them, they have two or three more in there. Instead of just going through this checklist of, okay, I heard number one and then dismiss it, really listening, like, what is the journey here? And really understanding that. So I think that is a big piece of it, is really about, you know, listening to the member, understanding what it is they're asking, and really being able to take the call from beginning to end, and hearing the member and their journey.
Nice. And Frederick, now taking this a little further along the lines, like, there is obviously standardization that helps, and that helps with efficiency, but on the flip side of it is delivering a better customer experience. So how do you like balance both these things?
Yeah. So um, I think for us, again, it's like two sides of the coin, right? There's the patient, and there's our team member. There's the human interaction, and then there's technology that can support that. I Two things that we pay particular close attention to is teaching, like, just emotional reinforcement. Hey, if someone tells you they're running late or they're upset, right? It's like acknowledging that, right? Like, there's a human on the other end of the line, and that sounds super basic. When you have never been in a call center, and that human reinforcement can get lost if you take 70 calls in a day, right? And it's important to remind people of that time and again, and to humanize everything that's going on. The other thing that we've tried, and that's working quite well, is to try to, as much as possible, pick up context about the member or the patient. So we kind of deal with both sides of providers and payers and MSOs, and to say, to kind of make a guess where possible. Hey, are you calling about your update appointment? Or, like, we can try to help our team members infer, and make the person feel known, right? And like, I have this one when I call Delta, let's say, and they say, oh, are you calling about your flight in 2 days? It's a nice opening, right? And you immediately feel like you're talking to someone that sees you as a specific person. I think technology complements this, right? So we invest a lot, and try to continuously invest into, how do you create that context? How do you um, help our team member find out who this patient is? How do you suggest answers to them? How do you allow them to focus on the patient without having to focus on the system? So I think that's where it still have a lot of work in progress and a long way to go, but that's the foundation for achieving that outcome.
Wonderful. And you touched a little bit about data and tech. So I guess my question to you, Troy, like, there is so much hype about AI right now. It's like, and it's probably one of the most talked about topic in customer service world, because it's been always been a talk of customer service for a long, long time. But how do you see the impact of it? And are you guys already implemented something on AI? Some initiatives already been deployed on your end, or and could you share a few areas where you think that might have a huge positive impact in your operations?
Yeah, so we definitely are down the road on some initiatives with AI, and there's a couple of things I would say to really be cautious of is one, your employees. So going back to people, because there naturally is a threat. If you're misinformed, it's like my job's going away, I'm no longer needed, and that's the furthest thing from the truth in our viewpoint. Because you cannot replace human interaction with something as difficult as healthcare. There's emotional ties. There's really kind of critical decisions that need to be made. There's support that needs to happen. And so we view it as like, how do we use it to make our staff superhumans and bring the information to them, make their job simpler, and really kind of show the true value add that they bring from the human side of it. So, yeah, it's great. It's a great tool. I think the old adage of find the needle in the haystack, right? You got all this stuff going on and it brings to light, here's the point of focus and here's what we need to be kind of addressing. So it just helps speed that up. I think it also adds efficiencies to the operation. So here talking about operations, like how do we become more efficient, more effective, optimize the resources that we do have. But it's not about like, getting rid of our staff. It's really about how do we make them better and make their jobs simpler.
Got it. And would you say that you're giving clear memorandum to your employees, like, hey guys, of course you're not trying to remove it. The goal is more productivity and get more efficiency going, and hopefully better outcomes and less errors in everything. And that's what it is, right? So, have you also started measuring any of these things and seeing already impact of this?
Not yet. We're new in the journey, like literally launching last week. So it is literally new for us. But one of the points that you just talked about that comes to mind for me is change management. So how are you really going about? What's the messaging about? Are you telling the why of it? Are you really kind of explaining, the value add, what it does for our members, what it does for our organization? So a lot of our intervention has really been through that piece on our messaging and our communication. And then also getting your leadership to truly buy into it and understand. So are they then cascading that message down to the front lines, from a leader's perspective, not a messenger?
Okay, and I like the superhuman messaging actually a lot. So, Frederick, what about you? Like, slightly different for context wise, slightly different on your end, because it's you're one of the value props probably is to make things efficient for everything. So, how do you view it? Like, where do you see? I guess first question is, have you also deployed any AI initiatives already, and how far are you with those? And then the second part to it is, what are the future outlook in your operations that you see that you'll be able to create using AI?
Yeah, that's a really interesting question, and we were talking about this the other week. What Troy mentioned, where we invest a lot in our messaging to our team, because really, um, what our message is internally and externally is that we want AI to replace all the stuff that is just completely redundant, right? If I'm on the phone with a patient and I have to check eligibility and some sort of a portal, no, that's not adding value to anyone. That's a really important step, but that's not adding value, right? And so and there's 1,000 of those administrative steps on the payer, MSO, and provider side, and so how do you automate those away so that the conversation really becomes educated and informed and proactive? That's our viewpoint. Now, it's I we as an organization fundamentally have built so that we test a lot of our technology internally, and we build our own way to augment and find patients and provide prompts, and this gets basically trained by our team, because we think that this technology and AI needs to be integrated into operations, and specifically in healthcare where data isn't flowing freely and processes might be complex. It's really hard for anyone to try to just automate a complex process off the bat, right? And so that for us is really the journey that we're going on. And as much as finding the specific member and flagging if there might be any care gaps to that, or to give a 360-degree point of view to the agent about who it is they're talking to and what they should be proactive with that person on the other end of the line, is really a lot of our work. And so that's the strategy. And I think generally it's about how do we chip away at all the stuff that really is a redundant workflow. And I feel like healthcare is just the leader of having important but not very patient or member friendly workflows.
It's and this is a little opinion I want to get from both of you. Like, we went through this era of like, hey, we'll have this interconnected world through EHRs, and quite honestly, we're still not there. We are far from there, and there's a whole mess going on. And one thing I'm personally worried about AI is like, yeah, we want to automate stuff, but will it also come with, again, a whole bunch of blunders of data where data is not standardized and AI doesn't work if the data is not right? And then what happens? It increases work instead of reducing work for everyone, at least temporarily for a few months. And teams have to go through those phases of trauma in that regard, and then only you get to that. I hope. I guess my question is, how are you guys cautious in that way, or do you see like, oh my God, I'm ready, but it's going to be that kind of cycle? How do you view this, Troy?
Yeah, definitely. For us, we lead with caution in that aspect, right? So for me, data, you need to have it, and out the gate. So when we run projects, we call them work streams, right? So you have kind
Mm.
of the requirements, you have the implementation, but then there's also a reporting work stream and a data work stream. So it all goes in hand. We don't wait and get it implemented and then figure out data. Like, no, we need to know this along the way. So like for instance, first couple days, the expectation is that every single agent that we have or advocate that we have is really signed up, because it's another sign in. So we have single sign on, but you have to be signed into the app. And if you're not signed in, we're looking at utilization reports. So first week was like 75%, and now we're up to like 90. And so we're looking at that monitoring. That's like step one, just making sure they're using the tool. And then I think another piece that some people skip is feedback. Sometimes they think it's just going well, and creating an environment, and that's one thing I really believe in, is an environment where people can be transparent and truthful. So if it's not going well, tell us. I don't want people kind of just sucking it up and being yes people, right? We need to understand what's out there, what are the issues, and how, because it's about them and how do we make their lives better, because then they're going to better serve our members. So I think for us, it's reporting, is data, is checkpoints, is getting feedback, is constant communication through those change management channels. Those are all pieces that I think will help make it successful.
And Frederick, what are your checkpoints? Are you following a similar path or something different?
Yeah, can you repeat the question 1 second? I
So,
think my internet
so
cut
the
out for the.
Yeah, so the question is, AI. It's are we going to see similar hype cycle as we had it for other tech, where before it became useful, we have to go through this all data mess, and it just increased the work instead of reducing the work, and it took several years to be where we are today. Are you cautious, or are you handling something differently? What's your point of view on that?
I am cautious. I think that the more you dive into AI, the more it depends on data that is accessible. And I feel like if there's one challenge in healthcare, it's the fact that data between systems is not very well connected. And it's actually really, really, really hard to create that integrated picture of the patient and stitch together all of these different systems. And so AI is only going to be as good as the data that they have access to, which will depend on the organizational maturity. And I talk to a lot of organizations who don't want their patient conversations to be the training model for other organizations, right? Which is the way that large language models and small language models work, right? So I don't Um, for me, those are really two fundamental questions that I don't really see how they will be resolved in the short term. Um, I think, though, in the medium to long term, AI will, the technology is going to change the paradigm, and I think there's no question about it. But those are really important issues, and I think you're absolutely right. We are still in 2024, and when you look at the amount of manual steps that you need to do to between an electronic health record and payer systems, and all the care coordination that needs to be done in a value-based care world, it seems arcane, right? And so I think we need there's a bigger question that this needs to be sorted out first for AI to really take off.
And maybe one thing I would add to that is just when you think about anything, there's a maturity curve. There's a natural maturity curve, right? So you start something brand new, you learn, you grow, and then you get more skilled at it, and it just kind of gets better. So one thing I think people need to put like a realistic lens on of it takes time. You don't hit a switch and then everything's kind of excellent and new and improved. It takes time.
Right. Yeah, very, very familiar path in healthcare. Exactly. Um, all right. So, Troy, so the second thing that I want to go back to, the second thing that I really, really liked, and I want to bring this up, you mentioned that to measure the customer satisfaction, and you quoted it, you want to hearing the customer smile. And how do you train and motivate your teams to deliver that? This is like high level of customer service. By the way, as soon as I heard about it, I was your fan, just in
Yeah.
full transparency. So so tell me about this, please.
Yeah, so there's a couple things. Going back to the staff, right? Really like so one simple thing is all of folks since COVID are remote. And so one of the things is how do you show up at work, and if you're in your home office and there's no one else, right? A simple mirror. So give them a little simple mirror and checking themselves as they get ready to kind of start their day. It truly makes you have a reflection, right? To go like, how am I showing up today? That's one piece of it, and then I think the other piece is just our general training that we do. So really having empathy. When you look at our populations, it's Medicare Advantage plans. Typically 65 and above is and that's a spectrum, right? There's some that are very kind of self-sufficient out in the gym, multiple times a week, and there's others that are really sick and need kind of a lot of services and care. So there's a whole spectrum of membership that we have. And how do you train that empathy? So one of the things, when my mother was living and she was a scan member, was that you show up and I want every member that you talk to, treat them as if it was my mother at the end of that line, or treat them as your grandparent, treat them as your parent. And so when you really personalize that, it really kind of draws that connection of empathy. And then at the end of the day, because we're a non for profit, we're really about our mission. So keeping our members, healthy and independent, and so helping everyone to believe into that, buy into that. And at the end of the day, so when you talk about creating a smile over the phone, it's a component of all those things. Is like, how did you show up? What is your training like? Who is it that you're trying to serve? And what is your goal and mission at the end of the day? And then when you think about just simple things like asking some of our staff, like, what was the best service you received in the last month or two? You went to get a hamburger, or you went to, a hotel, or you went to an event, and then helping them understand and reflect that back into what they're doing daily, then that's where the magic happens from my perspective.
Love it, love it. Frederick, any thoughts on this approach? Are you guys doing something similar?
Yeah, I think very much so. I think at the end of the day, we try to really remind our team members about the impact that they have, right? And that's through humanizing and sharing stories of patients, of members, of providers, of care teams that we've had the chance to help. And we also try to create a positive sense of inspiration and maybe competition about this by trying to highlight like this was a really positive interaction, and here is who set the bar, and why don't we all learn from that to try to meet that. um Honestly, it's so easy, and I feel like I work in this space a lot, and I sometimes forget. And I love listening to these calls because it's sort of you're so in your day to day, and especially when it's really busy and you're working through stuff, and there's maybe someone else on the other end of the line who's frustrated, right? And you're trying to do your job, and it's really hard. And so I feel like we try to do it as much as we can, and I would say we probably still don't do it enough because it's so easy in the hustle and bustle of the day to day to for someone to just be human and be frustrated, and you're dealing with a difficult situation. But yeah, we do everything around trying to remember people, remind our people on the mission, and what it looks like to be a patient or a care team member that's trying to help a patient. And honestly, the impact, I think people forget, right? If you take a quarter million, a million calls, those are a million touch points between patients and the healthcare system. You might navigate someone's mother, grandmother, aunt, uncle to help seek care that they haven't been able to, right? And those are such powerful moments, and I think it's like you just gotta find any way possible to remind folks that this is the impact that we're having on a day-to-day basis.
I this I'm thinking of this in like from a sales world. I saw a tool which was doing the analysis of the calls and giving the sentiments on the call in terms of emotions, like how good the call was emotionally. And there are a few tools that I've seen in the sales world, not necessarily in this side of the world, but I wonder if if a technology like that would be really helpful in just training and bringing out those examples. Have you guys seen any of this, or are you guys by any chance using any of these kind of technology to analyze those calls, sentiments, especially emotionally, so you can then also use it on the training side?
Yeah, so we've dabbed in a little bit, and to your point, there's a lot of tools out there. So it's kind of understanding what would be best for our environment. But it is we do a lot of back end natural language processing, and really kind of have a team that works on insights and brings that to light, and then we incorporate that back in to our training, to use cases. But to have it as an actual tool that feeds right is integrated in our system. We're not there yet, but we do have pieces of that on the back end.
Yeah,
Frederick,
and
is
I
your
think
team
it
building something? Go ahead.
Yeah, I think honestly it ties into this general notion about AI and where things stand with AI. The more we specialize in a lot of complex processes, right? And like the more you try to get into problem solving and really figure out what's the right way, and it's not always a clear answer that is pretty cut and dry, the harder it is for any type of tool to listen, right? A lot of the AI tools that do this type of work are really helping you follow a standard call flow, and like, did you follow the call flow? But that's missing a lot of the in between that is really really important to the member and the provider and the patient experience. And so we're honestly still experimenting with how to leverage that. I think this will probably be an easier evolution, but it is a then like really advancing AI as a whole, because it's a more defined playing field. But I'm excited to see where this goes. I will say that so far, what we've seen off the shelf isn't really suitable for a lot of the use cases, and so we're trying to figure out how we can enable our teams around that.
I'm going to do a little bit of backpedaling on this one. It's like, there is also this thing, right? Like how you were saying, if every AI model is just replicating the same kind of templates, there is no difference in the world. Everything will look like same, and that's I think no one has that answer yet in AI world. Like how that. Especially natural language or human language will be processed and seen in the world, and there will be proper analysis of that. We don't know. I don't think anyone has that answer yet, so it's too early to say it. But it's a good point, a good reminder to just think where this might be heading. Hopefully it will be useful, and that's the hope. But we also don't want to end up in a world where everyone is just using the same template. Everybody's just going through the 5 steps, everyone does it, which is very bad for everyone. Um, now I want to talk about both of your challenges in your current roles. So, Troy, what are few of the biggest challenges that you have in that your current role that you're still looking to resolve?
Yeah. I, it's almost like if you go to the supermarket and you go to get a box of cereal, like how many choices are out there, right? And so if you kind of bring that back into operations and technology, you think about, like, we just had a little bit of dialogue around it. How many options are out there? Are they the right fit for your organization? You know, you look at time, there's going to be time to implement, there's going to be cost to get it in there. And so there's all these factors that you have to try to manage. You know, it's for the good, you know, you need to do it. And so I guess at a high level, it's really like you get all of that out there. And so just getting the right fit for your organization, the right tools. And then I think the other piece is just overall priorities. So in healthcare, you know, we're highly regulated, which I think is a good thing to make sure that, you know, we're doing the right thing for members and patients. But it also kind of creates constraints sometimes. And so when you have those constraints, you know, you have to operate within those. So that is a piece of it. And then just overall, so those create like what I call the day job. So that's kind of, bread and butter. You got to make it happen. You got to do it. But then at the same time, while that you keep that train moving and keep it running well, how are you now innovating? How are you really kind of taking it to the next level? How are you differentiating so that we are the go-to health plan versus, someone else down the street? So those, I think, are just constant operational challenges. And then lastly, I would say just in a remote environment, in my opinion, is it's critical that you keep engagement with your teams. And so, how do you continue to get creative with that and ensure you have that tie and that bond, from your front line all the way up to me as the business owner?
Nice. And Troy, do you also have? Like, is it like all the entire team is in house, or do you have parts of it also with other healthcare BPO partners?
Yeah, so the majority is in house, and we do have, I'd say 10% or so that are with BPO partners, and those are near shore. So.
Got it. Okay, Frederick, how about your challenges? I mean, it might be slightly different from Troy's because you're also the CEO of the company. But keeping the healthcare operation side, what would you say the biggest challenges are?
The interesting thing is it's a lot of the same concepts, right? How do you continue to execute while innovate? And really for us, this is the we live in an industry where it feels like change is on the horizon, but no one really understands the change and how to appropriately digest it, because there's just a lot of noise out there, and really it's the same for us, right? How do we, at the end of the day, and Troy, I really like your term there, create superhumans and not get distracted by all the noise that can come by organizations, external organizations coming to you and saying we can automate, every part under the sun, and that takes time to investigate and figure out if that's really added value or a distraction. So I think for us that's the one component. I think the other part is, we're still a growing organization, and so for us, it's really about how do you make sure that you and we evolve our processes. We spend a lot of time and effort on training, and so how do we balance, for instance, being very conscious about the training and upskilling of our team members while not while finding that balance with the execution part of it, right? Because you can't sort of learn and execute at the same time, and both are really important concepts, and you don't want to overdo one at the expense of the other. And so I would say those are really the two biggest things that are actually somewhat similar, but really top of mind for us, because we want to try to stay ahead of where the industry is going.
Very good. And little bit looking into the future, how do you foresee the evolution of customer contact centers in next 5 years, Troy?
Yeah, I think there will be automation for what I call the easy stuff. So things that are repetitive in nature, things that are not very emotionally tied, and being able to kind of. So I think there's a play from a technology perspective to automate those kind of things. And then I think the other piece is it's going to be an interesting deal because what I've seen, and again, I think a lot of folks talk, pre-pandemic and post-pandemic, because that was like obviously a huge piece, right? And when I think about post-pandemic, folks really kind of got away from service in a sense and just said, it is what it is. We don't have the people. If wait times are 5 minutes, 10 minutes, then you're going to wait because that's what we have. We don't have the people. We don't have the force. And so I feel like that true commitment to service left a little bit. And I think kind of to Frederik's point around the noise that's out there, I think it's kind of norming now. It's coming back to go like, okay, you do have to kind of respect your clients and your members and your patients, and you are on the hook for providing that service. So I feel like that's kind of norming, and I think the technology will help assist, which will drive efficiencies. And I think long term, it'll be a good blend. So I don't know if that answered your question, baby, but I think it's going to be a blend
Uh,
of technology and human service.
so so technology for sure, but really bringing the customer service back in the game and making it better through
Yes,
assisted
sir.
technology. Wonderful. And Frederick, how about you?
Yeah, I think this will be a really interesting time for the overall industry. I agree that ideally in 5 years, the interaction between patients, members, providers, and the healthcare sort of ecosystem is going to be such that the easy questions that are straightforward can get answered on their own, and the stuff that is really complex where you would actually prefer to talk to someone because there aren't that many clear paths and you're trying to find answers, that gets really easy to do. you know i I wonder where this is leading, though, and how I think the industry at large will find a balance. Because the reality is that if you are, I don't know, if you're Apple or Google, right? Like AI, you can automate your customer service mostly way because the true answer is no one wants to talk to Google customer service or Apple customer service or whatever, right? The true answer is that this will never be true in healthcare because you do need to talk to the person. And so I think there's going to be a temptation for some organizations to think that healthcare is self-service. And like I think there's a very real macroeconomic trend around what's happening with costs and inflation that I think um, creates temptations. And I wonder where that will shake out, right? Because I think healthcare is fundamentally different. And and I think there's a sort of a large part in the industry. A lot of the conversations that I have of folks trying to figure out what that future operating model is like, and there's just so many unknowns. So I think it's going to be really interesting.
Yeah.
My
And
my
Vivek,
take. Go ahead, Troy.
yeah, one thing I was going to add to that, I think there's going to be a big play on video, right? Because
Mm.
Mm.
when you think about like what happened, where you couldn't kind of get in touch, like 6 feet apart, right? And so you get this video thing going on, and a couple of things that I saw come out of that, at least from a healthcare perspective, is access. So you think about folks that are in these rural communities, or they don't have providers or doctors, and so at least just that frontline care of being able to understand and diagnose symptoms. Obviously, some things you got to be in person, you got to get into hospitals, you got to get whatever. But I think the overall ongoing care and being able to communicate via video, so that blend of technology, I think is going to do nicely in the next few years to come.
I was actually going in the same direction because I always fear that with technology we try to go wide too faster instead of deep. And by that I mean is like, if there is, and this is just an example, like, and I worked in tech and health tech, and one of the things was like, hey, we're selling this patient messaging solution. Yeah, but can all age groups use all the things that they use for communication? Are you inclusive enough as a as a tech company? Like, are you going to still have people make phone calls to you who need to, people who get video message, people who get text? So I think that's important as it might change, but I think the focus should be still about, like, I don't want to use the term like just get better in one channel or another. Think of cover everything so that whole population is covered, even though there's small simple use cases, and then we move to the next use case, because otherwise there will always be drop-offs, and drop-offs means you have always an inefficient system in the process that you're building over time. So that's kind of my experience I've seen on the tech side, especially because I'm guilty of that too in early part of my career. um, Okay, so now because I have two gentlemen from different phases, different parts of healthcare world, one from the health plan, one from the BPO world. In what ways do you think healthcare organizations and like health plans and BPOs can collaborate more effectively to improve member services? Troy.
Yeah, my take on that is it's a partnership, right? It's not like, my way and my requirements, and here it is, sign up and do it. What I've seen is that it needs to be a true partnership. I think culturally, from the corporate environment, like, are you guys aligned in your partnership and what you're trying to achieve? So for me, that's big on, you know one, creating the partnership, and then for me, like, I look at it like they're an extension of my team. So what I've seen in other organizations is, hey, I hire this BPO, do the job, here it is, I pay you, and that's the end of the day. Whereas, for me, I go in from day one is like, you need to be like an extension of my team. I don't want to say like you're in another country, you're in, it's kind of a partner that we sign up with. Is like, no, you're Scan, and here's how we operate, and we kind of get along from there. So for me, it's driving that partnership, and like expectations, like goals, priorities, mission driven, and kind of having that same kind of cultural values.
Love that. Frederick, how about you?
Yeah, and really would echo a lot of the same trends. I think that um, we've seen our most successful partnerships ones where even at the onset we sit down and we help reinvent a process, or at least take stock of where the process and the procedures are, right? Because a BPO and adopting, in technology, when you say, if you digitize a bad process, you haven't won anything. If you outsource a bad process, you also haven't won anything. And I think that's always really an opportunity to also leverage external partners who, all we do is uh, work with patients and members. We have a lot of interesting ideas of how to even have the leverage technology, leverage operational redesign to improve processes where there's the possibility. So I think it's the best relationships we've had is where we've had that room, because sometimes organizations are very rigid and they're defined in what their process should look like, and that's okay, right? I think at the end of the day we are there to serve our customers, but I think it's you're missing on the opportunity to leverage innovation, specifically in a time like this where so much seems to be in flux. So I think that's one. I think the other one is um, I think there's a lot of BPO organizations that are just there to do a process and not be that partner, right? That Troy's saying. And what does that mean to be a partner? How about you stay ahead of regulations? You provide insight into what others are doing. You bring ideas to the table. And I think all too much that is not happening. And again, I think there's just, when you do something and that's the only thing you do all day long, you get a lot of perspectives and experience, and sometimes that experience doesn't make its way back from the BPO vendor to the organization, and for me that's always an opportunity that's missed.
So Frederick, if there is a health plan and they have their own technology and everything set up, right? And being a true partner, would you? So you are completely fine if they tell you like, "Hey, we don't want to use your tech at all. You're going to make our tech work, and your team will jump on it."
we have had many examples where we help fix our customers' technology. And specifically on the provider side, it's we try to go maybe sometimes to our detriment a little bit too deep into trying to be the solution engineer. Look, at the end of the day, our mission is we want to make healthcare more accessible for patients. We want to make life easier for care teams, right? And so if helping someone that is struggling with technology, and we just happen to be good problem solvers and technically adapt, if that gets the job done, that's great. Again, I think, where we can bring our technology to transform a process while achieving those goals, we like that. But that's, we want to be pragmatic at the end of the day, in the impact that we have.
Okay, great answer. Now I'm just going to conclude this show by one personal question, which I love to ask people. And Troy, we'll start with you. So, can you share a defining moment from your early life or your life that has shaped the person you are today? But this is something you probably haven't told anyone professionally, and this is your chance to tell us. So, what would that be?
Hmm. Um, I guess, I was the youngest of four boys, growing up. So it's an interesting road because my oldest brother was like my protector, and then the two brothers in between were the ones that really would get at me, right? And so and also being, the baby of the family, my dad kind of always looked out for me as well. So I had oldest brother and dad that would always look out. But I think it was just a challenge to really kind of, I think it would all worked out. Like the two in the middle made me tough. They made me really kind of, value hard work, hard ethics, and then having that bookend with that protection. I think it truly shaped kind of who I am as an individual. I think one other example was my high school basketball coach. It's like, if you step on this court, no less than 120%. Like, don't even show up. And so it just really gets in your head about, like, when you hit that court, you're going at 120%, and it just has carried in my life. It's, the way I approach things, the way my work ethic, the way I think about things. So I don't know if that answered you, maybe, but that's what
No, it does. It does. And to your father and to your siblings, shout out to them
yeah.
for what you are today, and to your
Yeah,
coach.
yeah.
Great stuff. Thank you. Thanks for sharing. Frederick, how about you?
Yeah, that's a really interesting question. I would say, when I was 14, I moved from Germany to the US, and it's an interesting age to move countries, because all of a sudden things that you have always taken for granted, right? Your language, your nationality, your background, right? Like those are all put into question, and I think it gives you a little bit of an outsider's perspective and makes you question some things that maybe you always assume. And I carry that forward in languages. I mean, we have a big team in Latin America. I've done business all over Europe and the Middle East, and I have learned English myself, and so you kind of realize that there's another side to the person, and you learn how to put yourself in their shoes a little bit more. Um, that actually helps you better understand where they're coming from, why they might be upset, what motivates them, and I think we try to apply this at scale, but I also try to apply that to my personal interactions with folks that I have on a day-to-day basis.
It's funny. I like we spoke about this in previous interactions. When I moved, and I was born and raised in India, and when I decided to move into my second life, which is my second career after engineering, I ended up in Germany. I didn't speak the language at all, and it was literally the first night I remember. I and my flatmate at a time, we were we didn't even know that you can't just wave and stop the cabs in Berlin, like for example, and you have to like call the number and then only it comes. And we didn't speak any language. Literally, I remember him looking at me from a distance while we were holding our food, and we were like, without saying a word, we're like, what did we do? Why are we here? That feeling. But afterwards, it gives you a new sense of how you immerse in cultures. And I'm fortunate enough to be living in third continent throughout my life, worked and lived. And through my work and through my life, and I found my wife here. So that's completely, she's American, so completely different story, different worlds. But I completely I think one thing that we underestimate is the value of just this meeting new people from different cultures. And this is so much valuable, in especially in the context of what we become, but also how it forms our world around work, how we think about work. And it's a different kind of respect. So I really appreciate you sharing that as well, Frederick. Well, gentlemen, thank you so much for being here. It's been a great chat. And Troy, where can our listeners find you? Where can they hit you up?
Yeah, LinkedIn is the best spot, and then yeah, I can connect with folks from there.
Great. And Frederick, how about you?
Yeah, I think likewise, LinkedIn is always a really good place, and then you can always visit us at www.thirdway.health. And thank you for having me, and Troy, it's really nice to meet you.
You as well. Thanks. Pleasure, gentlemen.
Thank you, guys.